There is some false information out there about hepatitis B that it can be transmitted through food and water. The Centers for Disease Control and Prevention, CDC, clearly states that hepatitis B is not spread through food, water, sharing eating utensils, breastfeeding, hugging, kissing, hand-holding, coughing, or sneezing. The WHO reiterates that hepatitis B virus is transmitted through contact with the blood or other body fluids of an infected person, emphasizing that it is not spread through food or water. Hepatitis B is primarily transmitted through exposure to infectious blood or body fluids containing blood. This can occur through mother-to-child transmission during childbirth. The virus can be passed from an infected mother to her baby during delivery. Sexual contact. Unprotected sex with an infected person can spread the virus. Sharing needles. This is common among drug users. Needles and syringes contaminated with infected blood are significant vectors. Occupational exposure. Healthcare workers can be at risk through accidental needle sticks or other sharp injuries. According to the World Health Organization (WHO), these modes of transmission are well documented and contribute to the global burden of hepatitis B infections. While many people with hepatitis B do not exhibit symptoms initially, especially in acute cases, those who do may experience. Symptoms include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice, which is the yellowing of the skin and eyes. In chronic phase, often asymptomatic until significant liver damage has occurred. When symptoms do present, they may include persistent fatigue, right upper quadrant abdominal pain, and jaundice. The Centers for Disease Control and Prevention, CDC, notes that acute hepatitis B can range from a mild illness lasting a few weeks to a severe, lifelong condition. Chronic hepatitis B can lead to serious health issues like cirrhosis or liver cancer. Hepatitis B is diagnosed through blood tests which can detect the presence of hepatitis B surface antigen, HBsAg, which indicates current infection. Hepatitis B surface antibody, anti-HBs, indicates recovery and immunity from hepatitis B virus infection or a successful vaccination. Hepatitis B core antibody, anti-HBc, appears at the onset of symptoms in acute hepatitis B and persists for life. The presence of anti-HBc indicates previous or ongoing infection. Prevention strategies for hepatitis B include: the hepatitis B vaccine is the most effective way to prevent infection. It is typically given in 3 to 4 doses over a 6-month period. Using condoms can significantly reduce the risk of transmission. Avoiding sharing needles and other personal items that might be contaminated with blood. This includes razors and toothbrushes. The WHO strongly advocates for vaccination as it has been shown to provide long-term protection and reduce the incidence of hepatitis B worldwide. Treatment for hepatitis B depends on whether the infection is acute or chronic. Acute hepatitis B often does not require specific treatment. Supportive care is provided, and the focus is on maintaining comfort and adequate nutritional balance. For chronic hepatitis B, antiviral medications can help reduce the risk of liver disease and prevent transmission to others. Chronic hepatitis B infection significantly increases the risk of developing liver cancer. Research published in the Journal of Hepatology confirms that individuals with chronic hepatitis B are at a higher risk for liver cancer, emphasizing the importance of regular monitoring and early intervention.